Hello everyone and welcome to Polaron's Multicultural Interactive Mental Health Forum, What About the Other 121%? I'm Stephanie Gogos and I'm the Marketing and Communications Officer here at Polaron, and I'll just be giving a bit of an update about what our event is about today. So we can go to the thank you. So we'll just be having a short introduction followed by a panel discussion with our 5 guest speakers today. This will be followed by facilitated community feedback, and we'll be concluding today's event at 4 p.m. Just a few reminders for everyone: keep your microphones turned off. If you have any questions or comments, you can pop them in the chat section, and we will be looking at them a little bit later. We also ask that when we do have the community facilitated feedback a bit later on, that we have timely responses. So I'm very excited to introduce all of our wonderful panelists today. We have Ingrid Oswald, Niharika Hirima, Sammy Huynh, Yamiko Nakamura, and Dr. Judy Chang. So Ingrid is the director at Mental Health at Work, as well as a life experience mental health and suicide prevention consultant, and has worked for a number of mental health organisations and initiatives. Niharika is a mental health advocate and commissioner for the National Mental Health Commission, and she is committed to improving wellbeing outcomes and reducing stigma around mental health. She also works at Headspace. Sammy Huynh is a school counsellor and mental health clinician at Headspace, as well as a peer support worker at 180. Yamiko is an occupational therapist, as well as a clinical consultant and educator at Origin, and her work focuses on delivering evidence-based and culturally responsive care for youth mental health. We also have Dr. Judy Chang, who's the director at Humane Health, as well as a clinical neuropsychologist, and she is one of Victoria's multicultural commissioners. So following our panel discussion, we do have some questions for attendees. They will be: what is important for mental health organisations to utilise language services? What are some examples of what worked and why? And what more could we all do to improve language services? So keep these in mind. I'll pop them in the comments section as well, and we will be coming back to them. I'll now hand over to my colleague, Zara. Thank you.
No worries. My name's Hasara. I am the Relationships and Growth Coordinator at Polaron Language Services. I'm here today to speak a bit about why we've decided to have this forum in the first place. And it was really just a chance for us to discuss how we can make mental health services more accessible for diverse Australians. We wanted to take a closer look at how we could utilise language service providers to strengthen and support current mental health initiatives. I'm sure many of you here today know from previous situation anecdotes, and of course some of your own lived experiences, that multicultural communities may be missing out on vital mental health support. With that said, bridging that gap is not easy, as many organisations face significant engagement barriers when it comes to supporting multicultural communities. We know that factors such as limited funding, lack of translation knowledge, and lengthy decision-making processes can make engagement quite difficult. We're hoping to address some of these issues today with the help of your input. I'd also like to elaborate a bit on our title, translating for the other 21%. I hope you picked up on the other part of the 21%. What we really meant by that was the fact that that 21% is quite diverse in itself, and there are many languages that are spoken amongst the diverse communities in our country. And now that Australia is becoming increasingly diverse, I think it's important that we consider that when creating and implementing services. Rather than translating existing resources into designed for English speakers, we should aim to encourage everyone to consider multicultural needs at all times when providing a service. We wanted to continue to utilise our mental health resources and language service providers strategically to encourage meaningful engagement and conversation. It's about investing the right amount of time and energy into efforts that resonate with people. And in essence, that's what we're trying to figure out today through this facilitated feedback. At the end of this forum, we'll be putting together an impact report, and this is just some of the examples of insights that we put together from last time's impact report, which was about co-designing resources for CALD audiences. We had some really great insights from our guests, including the importance of sharing information on multiple platforms, the importance of engaging with NADI certified interpreters and translators so that messages are accurately delivered. We also had some great feedback from interpreters who also highlighted the importance of speaking to communities in their preferred language. And lastly, we also spoke about how sending work overseas further complicates the communication between our governments and our communities. We'll be providing access to our previous report in the chat, I think, just about now, and we'll also be able to send it by email as well. We'll be putting together a report for this forum as well, so I'd really encourage everyone to really share your thoughts and your knowledge, because at the end of the day, you're here because you care and your impact does matter. And ideally, this report is something that you'll be able to share with your colleagues and anyone else that you would love to share this information with. That's all from me for now. I'm going to hand over to our director, Eva, who will be running the panel portion of this forum.
Thank you so much, Sarah, and also thank you, Stephanie, for the introductions. I think it's fair to say, and everybody knows this, I'm not going to say anything that's new, that we are stretched, we are stressed, we are under the pump, however you want to put it. We have been struggling a little bit in places, and we find lots of things challenging, and they may affect our mental health. You're seeing there on the screen some statistics from Lifeline and Beyond Blue, also UNICEF. And we know that COVID, the situation we found ourselves in, is putting extra pressure on everything, on the systems and on people. And, you know, every now and then at Polaron, we wonder what happens to that 21%, because we are seeing lots of money being thrown towards mental health services. Everybody talks about what a priority it is to get extra support, but what about people that are culturally and linguistically diverse, whatever that means? We all know that it's a bit of an acronym that's a bit unclear in terms of what it means, who does it involve. But you know, from our experience, and again, a lot of it is anecdotal. I couldn't find statistics that I could put up on the screen there for you that would neatly explain what's happening in the cult space when it comes to mental health. And that's a bit of a shame. So today we're going to try and encourage, at least have a good discussion about what's happening, and more to the point, what should happen. And we're going to, with our panelists and everybody else that's joined today, we're going to share our knowledge, our experiences, and see if we can come up with some practical ideas about how to help, what to do. So the impact report that Sarah's mentioned is one such document, and she's already mentioned that the one from the previous forum is also available. All right, so let's get to it. Let's hear from our panelists. We've prepared 3 broad questions. The first one is, and I'm going to start with Ingrid actually, is what is one major gap? And Ingrid is someone that I've met about 10 years ago actually, and we kept in touch, and I have a lot of respect for her, given her experience in this sector. Ingrid, what is one major gap that you are seeing when it comes to engagement with multicultural audiences?
First of all, Eva, thank you so much for the invitation to participate today. I'd actually like to acknowledge the traditional owners of the land on which I stand, which is the Wurundjeri Wurrung people, and pay my respects to past, present and elders who may or may not be here today. I'd also like to acknowledge people with lived experience of mental health challenges, of suicidality, their carers and those who may be bereaved. This is an interesting subject, and one that I have to say, as I was preparing for, felt very emotional. Why? Because my cultural community is what has shaped who I am. And one of the major reasons why I started my career in advocacy was because I knew that in my upbringing, my culture, we were not equipped to face or manage mental health issues. I grew up in a very Latvian environment. My parents had arrived from Latvia in 1949, and I was seen as the white wog kid growing up at school, had a really dressed up like a tiny version of Heidi on the Alps of Switzerland, very bullied and teased, and I had a lot of dysfunction in my home life, in my family. There was a lot of mental illness. In fact, it was so much I don't know any different. I had family members who had drug and alcohol problems, gambling problems, eating disorders, of which has been passed down to generations. So I've been a carer as a child of parents with mental illnesses and family members. Likewise, I myself am touched by bipolar disorder, binge eating disorder, post-traumatic stress disorder, and I've been managing life with binge eating disorder. And it's all interrelated to my family and my culture. And the fact is that as I was navigating my journey with my parents and my grandparents, we never talked about mental health challenges. We never went there. And in fact, we had to show, when I went to Latvian school and to all the Latvian activities we did here in Melbourne, was that you had to put on a happy face. You had to put on the mask because you couldn't share what was going on with your personal life. And you dare not betray the family with the dirty linen. And it would put shame if anyone knew that my mum was in and out of psych hospitals when I was little, or that my parents had drug and alcohol problems, or that someone else had some other mental health vulnerability. So it was seen as something you do not mention. It was viewed as a betrayal. And so those early years of my life, having lost someone to suicide that wouldn't be buried in this state, and again, giving my age away, more than 50 years ago, that was so daunting. You know, it was seen as a crime. Let's fast forward to today. I'm actually really nervous sitting here because I know from looking from in the inside, what has the Latvian community done around this? Very little. Why? Because of absolute fear still. What I grew up with, yes, it's moved a little bit because of awareness. It's also increased because, a few of us have found the courage deep inside to stand up and say, actually, we've got this. It's a community issue and we have to talk about it. It's a painful subject. I have family members who will not ask what I do. Still, 20 years down the track, they don't want to know. It's too much. Whereas I've had others who do want to know and who are starting to be willing to talk about it. So one of the major gaps in the community that I work with, and in fact, I'm still afraid to work directly with the Latvian community because I know this is such a difficult issue. So one of the major gaps is stubbornness, narrow-mindedness, conditioning, fear from within the community.
Right. You have explained that so succinctly and clearly, Ingrid, and I would say that what you spoke of probably applies to many other, if not all, the communities. Sammy, what about you? What is, in your experience, the major gap in mental health space when it comes to cult engagement, or how we're having these conversations that we so bravely got started with Ingrid's voice with?
Thanks, Eva. It's really great to be here today and to speak about such an important topic. So whilst listening to the things that Ingrid was talking about, it really reminded me also about my upbringing and how my culture intersected with my mental health. So in my experience working in the mental health field, one of the major gaps that I have found is mental health stigma. I feel that there is a lack of culturally responsive mental health literacy and awareness, which is specific and accessible to the different cultural community groups. And mental health stigma in cultural families can really prevent a young person experiencing mental health struggles to actually access mental health services. And this contributes to reducing the likelihood of early intervention. So young people may be experiencing symptoms and not seek support until they reach the acute phase. And that's usually hospitalization. When young people from multicultural backgrounds do access the services, there are tons and tons of challenges because some services take an individualistic approach and use a default Western mental health framework to engage with multicultural young people. And they can be limited to no involvement sometimes with the family. And as we know, the socio-cultural context is so important. And things like family, cultural values, and beliefs are very, very important. And, they shape who we are as people. So not taking those into consideration is doing a disservice to young people. And some of the reasons why this can be challenging for young people is they rely on their family for transportation, finances, and sometimes even consent to access the services. And when we support multicultural young people, it's so important to view them at the center of their ecosystem. There are so many other environments and systems that interact and influence each other, and they can impact on anyone's mental health. So leaving family out of a young person's mental health journey can leave a huge burden of responsibility on them to advocate for themselves.
And Sammy, you paint a very complex picture, of course, which's got lots of different elements and moving parts. Niharika, can I ask you to contribute to this question for us? And what do you think is one major gap when it comes to CAL engagement?
Absolutely. And thank you so much for having me. And I, like Ingrid, also want to pay respects to the Wurundjeri people of the Kulin Nation on whose land I'm coming to you from today, and all the lands that you're all on as well. Yeah, I mean, I think as Ingrid and Sammy also went into, obviously, a lot of those systemic issues that currently exist that form pretty significant barriers in this space and in this work. Yeah, I mean, they're kind of really quite deep and entrenched, and in terms of major gaps and for me a major opportunity, I think, and Ingrid, you were talking about the kind of stress that you feel, or the kind of strength that you have to hold to speak up on those issues and be able to speak openly on them as a means of holding space for the other members of your community. And I think, yeah, one of the major gaps is sort of additional supports, emotional supports, but also capacity building of bicultural and bilingual mental health advocates and professionals and workers. Sammy, you were talking about the largely Western sort of system in which we're all kind of functioning in and trying to find our way. And, I mean, everyone on this call is a perfect example, I think, of what it means to try and find those avenues of working within a system that doesn't exactly align with your cultural values or your cultural background. And one thing that kind of gets lost in that is how much that takes from you personally as well. Ingrid, you were saying, like, not one person is able to understand what you do for a job. I remember one of my earliest mentors had been working in this space for 25, 30 years. And, at the end of this incredible dinner that we had, and she was telling me about all of her learnings, she was like, my husband still doesn't understand fully what it is that I do. I've been with him for 15 years or 20 years. And just the having to sort of straddle both of those worlds, where you are a personal, it's a personal experience for you to be in that space, right? Being an immigrant, being someone who speaks a different language, being someone who has a family who has different cultural values to the people around you, but then also working in this space and advocating in this space. And oftentimes it is those people who hold almost the staff in particular organizations about the importance of doing culturally responsive work. And so how can we start to support and build the capacity of those folks, whether that's a lived experience advocate or a peer support worker, whether that's a psychiatrist or anything in between, and being able to really understand and help support the people working in this space, I think, is a big.
And of course, Niharika, we're preaching to the converted here. It's how to actually make the mainstream less mainstream, and listen to those voices. Dr. Judy Chang, I'll get you to contribute at this point. I know that you've converted some of this frustration that we're speaking of into something quite positive with the Heart Chat app or website. How would you answer this question that we have there on the screen? And that is, what is one major gap still in terms of engagement of multicultural audiences?
Definitely. Thank you for that, Eva. And it's so lovely to see you again. I'm also coming to you on Wurundjeri land of the Kulin Nations, and I pay my respects also to elders past and present, and I acknowledge the absolute richness and experience and wisdom of 60,000 years of culture on Aboriginal land that we meet upon. When I saw that question, my very first thought was, I can't narrow it down to one major gap. And then I realized we had a time limit on these things. So if I did have to pick it, I personally would like to highlight the systemic barriers that are there. And certainly I absolutely acknowledge, you know, and absolutely agree with everything that Sammy and Niharika and Ingrid had also mentioned beforehand. Stigma is an absolutely big barrier for me, which I also typed in the chat, and I see people chatting there as well, is how do we address that stigma in that place? But if we have systemic barriers in place to make it difficult to have that stigma be addressed, we're already hitting our heads against the wall, if that's the case. So I feel in lots of ways, starting with education and having a strong understanding about and educating our future mental health professionals and advocates around understanding cultural competency and cultural awareness would be an excellent first step, so that the future generation moves on into becoming policymakers and so forth. So if I really had to narrow it down, I'd pick to that. But I'm also mindful that we've got some great expertise within Sammy, Niharika, Ingrid, and also Yamiko, which is yet to speak, sort of working within the youth space. And I'm sure they'll have lots to contribute in that aspect as well.
Right, thank you, Judy. So I think it is about speaking up, right? And asking for better than what we have been getting. And we'll.
It is. It is, but it's also knowing what's missing and what's better, which is why we have fantastic forums like these and discussions like these to find out what is missing, so that we can then elevate our voices to say this is what we need, because we're going to be talking about later what changes do we need, but who is there along the lines of power, lines of privilege to make those change. And certainly in some ways, you know, a lot of us coming from a migrant background, so I'm the child of refugee parents. You know, for me, even being able to get into becoming a multicultural commissioner, or commissioner in that sense, it's not an easy journey. You know, I mean, we all had, as being multicultural people, certain levels of barriers within a westernized culture to get to where we are today. And that's why I'm so particularly passionate to try and, you know, empower and bolster other people to also raise all of our voices together, so that there can be change within the multicultural and mental health setting, which I'm particularly passionate about. Yeah.
Some really excellent points. And I'm going to ask Yamiko the same question. But before I do that, I just wanted to mention something in the way that we think of this space. And this is a message to kind of mainstream organizations, whoever you are there, if you're listening. And that is that we need to stop talking about communities being difficult to engage. It's actually the foot is on, the shoe is on your foot. That is, you don't know how to engage, okay? So Yamiko, can I get you to contribute to this question? What is the major gap that you can think of when it comes to engagement?
Yeah, thanks, Eva. And I think that is such a great point. And it's kind of a relief actually to hear Judy talk about the enormity of that question, because I guess it's something that I've really been grappling with, and our team's been grappling with. So a bit of context, we've been developing some resources for the youth mental health workforce in terms of working with multicultural young people and families. And so it's something that we've been asking ourselves, but also asking young people with lived expertise and sector leaders as well. And I guess my sense is that, of course, we need to centre, you know, young people and families in terms of what their needs are. But I think within mental health services, sometimes the focus is it masks the responsibility, I guess, of staff working in the system, and it can sometimes project culture, onto others and not really see the influence of what's going on within our mental health system and within our organisations as well. And of course, mental health workers bring their own, personal kind of cultural influences, but also influenced by the organisations and the systems that they work in. We do things in a particular way, or we follow a particular research, but it's not to say that it's necessarily culturally safe or it's inclusive either. So I think it's some of those like systemic changes, I guess, creating space for workers to be supported, to critique and to think about these things, to think about how they're flexible in working with young people and families. And it's even more needed, I think, when this, the system's overburdened as it is at the moment in Victoria and across Australia as well. And so I think some of the stuff that other, people have talked to already, that sense of having a more multicultural workforce and multilingual workforce, that it's safe to have, a multicultural workforce in the mental health system as well, and how we create that change. And then how we kind of advocate for young people and families to have that voice and change in the system too. So very broad things, but it's been lovely to hear from everyone as well. Gives me a lot of faith.
And Ava, you also
excellent
mentioned
points. Yeah, go Judy.
I was going to interrupt with you, Ava, because I really wanted to highlight the very crucial point that you made at the very beginning, which is that you had a bit of trouble finding stats. So, and again, if you talk about major gap, one of the major gaps is there's just not enough research on out there, and that's what you're seeing. And what happens then is, and this is all like a negative feedback loop, you go to government, you ask for funding, they ask for evidence, and then you say we don't have any, so they go, well, there's not an issue then. If there's no evidence, there's no issue. So how come we just cut a bit of that funding back? So everything's all interconnecting in that sense. So in another major gap, again, like I said, I couldn't bring it back down to one. It's funding, and putting funding into research and data on top of that. So anyway, I shouldn't interrupt.
No. It's a very it's an excellent point. And look, the other thing when it comes to numbers is talking about the cost of not getting this right. Okay, so there's the human cost, but there's also the cost of hospitalization, and some of you have already mentioned all of that, or just being the system being stretched to the point of not being able to cope. And I think, statistics and data, which I honestly, we've looked and looked, there's really not that much, can springboard this question and present to the governments an issue that that's based on numbers rather than anecdotes, right? We'll move on to the second question now, Stephanie, if I may. And this one I'll pose firstly to Niharika. And it's about organizations and governments, because I know you're very passionate about, this whole topic, but we're talking about language services. And thank you everyone for contributing in the chat, because I've been reading these comments about interpreters and translators, bicultural workers. So language services is all of that, yeah? So it's not just about translating a fact sheet, putting it on our website and hoping that people will find it. It's about a lot more than that. Niharika, can I ask you to contribute at this point, please?
Absolutely. And yeah, I think I want to also preface this by saying I used to work as a peer support worker across some of the most culturally diverse parts of this country. Was lucky enough to do some of that work. And one of the big sort of major issues in terms of utilization of language services, if we're looking at that sort of local viewpoint, is the lack of knowledge around that in the workforce, and not putting the onus on the workforce to know automatically about those things. I think there is a place for organizations to really be very specific about having set processes and understandings of new people, for example, who are coming on. Like, what are the processes that they can take to better engage with language services and support services for people from diverse backgrounds, and really being upfront about it at the start, rather than waiting for it to be something that, when it's come up and people have to start kind of looking for that information themselves. I think it's a really easy, obviously funding is an issue and it'll continue to be an issue till the end of time. But one of the bigger things is also that once those services have been funded and they do exist in the community, how actively are organizations taking that top-down approach about being open with that information, clear, accessible information that can go to all levels of the organization and actually be there when people need to use them, and thinking really critically about that.
So some excellent points. And, when it comes to money, I'll tell you what I hear out there. There's lots of money being thrown at mental health, including language services. It's how it's used that's a big question. And I also think that sometimes language services like logic. So we tend to have a fight or flight response, or be very much focused on now rather than in the future, and like really looking at communities. And sometimes organizations go for top 10, done, that box is ticked. And there are lots of smaller communities, such as Latvian. So I'll hand over with this question to Ingrid now. That really, because they're not in top 10, not in top 20, not in top 30 anymore, right? Yet the needs are really much greater, and there are people that are frail and maybe with more needs than everybody else. So would you like to comment on this? So we're talking language services. How can organizations and governments better utilize them?
Better utilise is always the challenge, isn't it? We've actually got to lean in. Government and organisations have to lean into these groups, because a lot of these groups don't know what they don't know. They don't know what's out there. They're thinking, and I know that in our Latvian community, there's actually this acceptance that, well, mental illness, it's there. You've got to accept it. There's no other option. That's what I grew up with. And I see my elderly family members in nursing homes, in hospital care, where they're thinking, well, I'm depressed because I've got one foot in the grave. Why should I be happy? That's just the way it is. And it's like, no, there is another way, but they're conditioned not to see it. So they don't know what's out there. They're afraid of going out to look because they don't want to get disappointed. They don't want to get rejected. It doesn't come to their mind. So it is about education. And this is where co-production is really, really important, to go to the leaders in our communities that are doing this work and really ramp up what they're doing and actually cross-share one culture to another culture. Maybe some of the top 10 can work with some of those that aren't the top 10 or the top 20 cultures that are being given attention to. And as you say, there's a lot of money. It's where it's being used, where it's being funneled into, that now we've got an opportunity to actually help bring about huge change. And it is back to the fundamentals of family. It's where I started from. We have to lean into those people that don't know what they don't know in order to help them feel supported, to feel more comfortable, to share that compassion, because people are afraid. It's that, oh, this is a weakness, this is a character flaw. You dare not share your secrets because people will judge you. And then you throw in the status anxiety that some communities and cultures actually experience more than others. And we've got a real storm brewing, and COVID is really hitting into that.
Thank you, Ingrid. Sammy, may I ask you the same question? And you are quite experienced across the board. What about language services? How can they be better utilized? So rather than organizations, often organizations get lost in the logic of, we hear this feedback of someone saying, well, if I translate my fact sheets, people will expect me to be able to provide interpreting services. So I think some organizations are simply worried about capacity or budgets and things like that. What would be your suggestions of how to better utilize language services in mental health?
Thanks, Eva. Yeah, I'd just like to echo some of the things that have already been said, but I think that organizations and governments need to make more effort and start establishing and making connections with language services to begin with. So sometimes they can feel like there is a disconnect, and I think establishing relationships and maintaining them is one of the first things that can be done. I also think that involving multicultural people and their voices who have accessed mental health services and gaining their feedback and their input on the implementation of language services in the mental health space, because I think participation is really important. And I think if we are not involving the people who are being affected by the issue and everyone is making decisions without involving the group, I think that is, doing a disservice to them. I also think that in terms of being able to access mental health information, what do people from multicultural communities do if they want to access information? You know, what is coming up on Google, for example, if they were to use Google? And I think in terms of awareness, it needs to be more than just on the internet. I think there needs to be states and nationwide campaigns happening to promote things like language services in the mental health space. And in terms of the information that is out there, I think we need to start moving away from a monocultural approach and start focusing on a culturally responsive framework, which assumes that mental health literacy, information, and resources will be received the same and understood as how it is presented in a Western framework. So I think it's really important to start moving away from that and start looking into how is mental health understood in these communities? How can we reach them and demonstrate the information in a way that will be perceived? So an example of this might be when we talk about things like trauma, having insights and explanations about intergenerational trauma and the various ways that can impact on a person's mental health and everyday life.
Excellent point, Sammy. Yamiko, I might just go to you just briefly in terms of language services. How can they be better utilized for the good of the community and also for the good of organizations? Because I think, my experience is that lots of organizations have very good intentions, but when it comes to the practical application, they might struggle with that. So would you like to contribute on this point?
Yeah, sure. I mean, I think organisations have kind of a great responsibility in setting the tone and expectations around inclusive language services, but also the role of language interpreters as well, and that they're really kind of respected for the cultural knowledge that they bring and the impact that they have in terms of the effectiveness of treatment for young people and families. And so I think sometimes staff in services see language translation as purely kind of, word for word translation and don't really think about the impact it has in terms of shared understanding, in terms of kind of sense making and meaning, but also thinking about engagement and trust, and we did some consultation recently with language interpreters, young people, and with the Origin Youth Refugee Access Program. But it was a really good opportunity to get some of that feedback, I guess, around the way that language interpreters act as a bit of a bridge, I guess, between mental health services and young people and communities, and how we have responsibilities as workers in making sure that they are included as part of the care team. And I think that happens, obviously there's responsibility for individual workers, but I think like what Neharika was saying before as well, that organisations set expectations around what that looks like and that it's clear around what best practice actually looks like day to day. And then it's not just what happens in the room, but how things are set up and kind of a whole range of areas that we could go into, but I won't.
Absolutely, and interpreters also need training and support and debriefing and all of those things that we provide to clinicians or people that work in mental health space. But sometimes we forget that interpreters can also be stretched or not trained properly. Judy, I'm going to ask you to answer this question because I know that you're someone that takes things into your own hands sometimes, right? Frustration. What can organisations and governments do to better utilise interpreters, translators, bicultural workers, people that are multilingual?
I think all the other wonderful speakers have given lots of organisations and governments to lots of things to think about already. To add to that, I feel language services have a critical role in changing the conversation and the discourse around mental health and facilitating mental health understanding between our communities and organizations and governments. Language differences and how we understand and communicate mental health well-being, but also clinical, from a clinical aspect of mental health illness, is vastly different. There are some languages where perhaps mental illness has a stronger connotation compared to other languages. So then how do we talk about mental wellness without using the word mental, for example? And that's where language services are so important in advocating and generating that discussion around what's the best way to communicate this information that reduces stigma, that facilitates communication and understanding. So, I'm trying to go on add a different path on top of that. And I know actually Niharika probably explained it even better than me with what she wrote in the chat anyway, which is basically, doesn't say exactly what she wrote. So especially in such complex cultural understandings of mental well-being, language services are, I believe, are absolutely crucial in being able to accurately translate and communicate that meaning across. And we really should work and ensure organizations and governments work that much more closely, not just hire them, do this translation, but say, hey, this is the message we're trying to get across. Are we doing it properly? Or are we actually making things worse by doing a direct translation into something that, that might cause more stigma or more misunderstandings?
And real damage, I guess. Thank you, Judy. So we'll move on to the next question, but I just wanted to let everybody know that we are reading your comments and we're going to include you shortly in the discussion, but lots of very, very valid points and certainly lots of learning happening. And all of you that have contributed to the question before have made really interesting and valid points. Again, it's, are we preaching to the converted? How do we get that message to organizations that, I'm not going to point fingers today, but I can tell you that if you go to websites, some websites of some mental health providers, by the time you find any information that's translated, by the time you find the interpreter symbol, you're out of there because everything's in English. You come in and it's just not inviting for that 21%, which is what we're going to talk about now, and that is how do we amplify, and we've covered some of it, but Sammy, what can we do to include everyone in the conversation about mental health?
I completely agree with you, Eva. I think that in terms of the visual look of websites, mental health websites, it looks mainstream and it doesn't really cater to the multicultural community because of how it's actually laid out. So I completely agree with you. I think it's super important that we create more spaces like this so that people from these communities can speak up about what's affecting them, and for the wider population to think about how can we be more inclusive when having these conversations, and how can we avoid being tokenistic and actually genuinely caring about the multicultural communities. Asking these questions to inform the way we work and interact with the community groups. I'd also like to say that there is a lot of power in forming reference groups and advisory groups for multicultural communities to have an input in the design and implementation of mental health services for their communities. And this includes things like the very initial point of contact when they contact a mental health service. I think it's also really important that we ensure that the increasing cultural and linguistic diversity of the Australian population is a core consideration in all mental health policy making and funding for policy implementation of mental health service design and delivery, and actually involving the full representation of these community groups who have experienced mental health issues and their families as well, and involving them in the policy making and decisions at a local and state and national level as well. I also think that there is so much power in drawing from peer work in the form of lived experiences from people in the community to act as advocates and educators to the mental health space, because their experience as diverse individuals who have access to mental health services can really shape the future. And I think there is so much importance in involving them in this process. And to echo what was said earlier, there needs to be more research and data, because without reliable data about the different types of mental health conditions in CALD communities, it's challenging to evaluate whether these attempts to improve mental ill health for this population is even effective. So further comprehensive research is essential to improve mental health outcomes.
Yeah, some really excellent points there, Sammy. And one thing I'll also add there, of course, is that someone already mentioned this, but, you know, in a Zoom room full of digital natives, we sometimes forget as to how many people don't even have a phone or a internet connection, or, you know, the literacy levels are such that they cannot access information that's put online. And the other point I just wanted to make quickly is that I live for the day where we no longer talk about the other, so that everything's more integrated and obvious that there are people who may struggle with whether it's literacy or English or whatever it is, that we think more inclusively of everyone in a genuine way. Yamiko, what can we do to amplify people's voices, the other 21%? What is it that we can do in practice, do you think?
Yeah, I really relate to what you were saying, Eva, in terms of reducing those barriers. You know, and I think at a service level, you know, we need to be asking who we're not engaging with, you know, who we're not hearing from, you know, what are barriers that they're having? What is it like for, you know, young people of colour, for example, to give feedback or give direction to institutions, which, you know, mental health services are often part of. So I think, you know, as Sammy said it so eloquently in terms of community engagement at all levels, but there's an element of how we in services think about that and what we're not seeing as well.
Thank you for that. Ingrid, what else can we do to amplify people's voices?
The challenge is getting the lived experience voice and storytelling out. And I say that's a challenge because as I started when we first commenced at the beginning of this panel, I still have my own self-stigma and fear around working with and talking to my Latvian counterparts. I get still lots of private messages through social media because we've still got a community that's really, really, really scared to talk about this. The challenge then becomes we need a safe environment to do this. We need to feel safe and supported in order to share our lived experience so that when we do, it's okay to be vulnerable. And if we're vulnerable and something triggers us because we're constantly putting ourselves out there, that we may be re-triggering ourselves and putting ourselves in a position where we may get distressed again and may create a whole lot of other challenges and it'd be re-traumatizing. So how do we do that's a challenge? And I think it's these sort of forums where we can start sharing each other's stories and keep going with the conversations and maybe even changing the narrative and challenging our different cultures to say, well, how can we be culturally sensitive, but also be brave and courageous to go through the challenges together so that we can find a better way, and if not for this generation or the generation before us, but for the next generations
to come. Thank you, Ingrid. Niharika, I think you might have some answers about how to amplify people's voices, right?
I don't know about answers. I do like to ask questions though, and continue refining the answers as we go. I think, no, I mean, look, some incredible points have already been made, especially about the importance of engagement of communities. I think one thing that I would add to that though, is really actively trying to bridge understanding and that capacity building of the people who are having that input. So whether that's young people and their families, but also tapping into the wealth of knowledge within communities, community leaders, cultural leaders, religious leaders, like the people that in the community that are trusted and have a place in that community. And much like what Ingrid was talking about as well, in terms of trying to build that trust in a way where we meet people where they are. You know, if I reflect on my own family or my grandparents, for example, very religious people, and so have a lot of trust in the religious leaders in their particular community. And how do you start to actively address some of those barriers that exist in terms of having them be engaged in the services? I think it's not enough to identify that those barriers are there, which is often where a lot of organizations will stop. Yep, we're not engaging with these communities because of this, and this. But I guess what's the next step? What are we doing to address and actively work on those barriers so that we're bringing those people into the conversation, and just ensuring that, you know, and thinking about the importance of that, and building the importance of that so that it has an impact on policy and systemic change.
Right. Thank you, Niharika. Lots of very valid and inspiring points. Dr. Judy Chang, this is the last question and the last minute of the panel discussion. Tell us what we should do. Do you have any answers?
Yeah.
Ideas? Ideas are also good.
If only it was so easy. I absolutely love what everyone else has been chatting and mentioned so far. I think it's really important stuff. If I had to add anything, I would say a way to amplify everyone's voice is to really try and empower a lot of the new and emerging, and I'm being very practical now, a lot of the new and emerging communities who don't necessarily have the mental health advocates or professionals yet in Australia, to give them the capacity, the tools and the support to build their own mental health professionals and advocates and leaders leading the understanding of mental health within their community. So as an example, the Karen community, that's quite a new and emerging, what we consider a new and emerging community. I spoke with some people within the community and they don't know of anyone else who is of Karen background that is a mental health professional or an advocate. So that means anyone from that community, when they have to access a mental health professional, they'll be accessing someone that might not necessarily share the same cultural values or shared cultural understanding as a basis to build rapport and having that therapeutic relationship. So from a purely practical sense, really giving a lot of new and emerging communities the skill to the skill and the support to be able to support and work within themselves, I think will be one of the many avenues that we can do to amplify everyone's voice, to include the other 21%.
Yeah, thank you. And I think I'll go back to just for a minute there to something that Ingrid has said, and she has talked about those intergenerational issues, but also the fact that many communities have done it. There are some success stories out there, and perhaps there's not enough information sharing or sharing of those experiences across different, communities. And that is perhaps, Ingrid, what we could be doing more of, right?
Absolutely. And I think one of the things that's really come out during COVID is the power of that connectedness through our cultures. That we are strong within our cultural groups, that there is a lot to be said. In fact, that can be a bit of a downside because that's one of our challenges, is we want to be together in our particular cultural groupings, our families. And so there are examples right there within our own reach of the importance of connectedness, the importance of helping each other. And I think that's what we can do across our different cultures. And we are doing it to some degree. I just don't think we promote it enough. enough within the cultural communities. There are a whole lot of campaigns at a national level for the general population, but I think that we need to go out there and, as you said, share the positive experiences, the things that are working. And I know that there are organisations that are doing very specific tailored peer support programs within cultural groups, so that, and for gendered groups, so that people can come together in their particular area that they need to feel safe and supported, that they can share their concerns and what they're experiencing, to tell their stories and be allowed to express those stories. Now, they're happening in lots of little pockets around Australia, but not enough. And I think it is that promoting and expressing to people, this is okay. These are symbols that people are slowly getting out there and sharing their experiences, so that others can feel confident and to work through the discomfort of what are uncomfortable issues.
Thank you, Ingrid. And we will get to all the points that there's lots of very interesting discussion going on in the chat, but there's just a couple of things I wanted to say from my own experience. And those of you that know me know that I come from, Poland originally, but I've lived in Australia for a long time. But I still believe what the government says, right? If you give me a brochure or what an organization said, I will actually read it and think, okay, that's what they're going to do. So don't disappoint me. Don't say things you don't mean. And, like I've been through an experience with my mother of palliative care, which was nothing like was in the brochure, right? And what I would have done if I knew this, I would have gone and done my own thing. But I was sitting there thinking, like I've read your brochure, help me. And it just wasn't happening. And I think also the power of language and education. When I first started in this field 20 odd years ago, we were educating the mainstream about dementia, right? And we're now all educated, and that education has actually made it into other I guess linguistic and diverse communities. But with mental health, we're not there yet because the translation, the language services aren't keeping up. We still kind of having infiltrated, I think, some communities where all the stigma that we spoke of as part of the panel is still there, because that information hasn't made it into some communities. And therefore, when young people, older people turn up for service, they haven't had that knowledge because we haven't given it to them, or we wrote the brochure and they believe it, and they, the experience that they are experiencing isn't what we said that was going to happen. I'm going to hand over back to Stephanie now, and thank you so much for this really fascinating discussion and lots of very interesting points. So Stephanie, over to you for the next lot of community feedback. Okay.
Thank you so much, Eva, and thank you so much to our amazing panelists today. It has been so wonderful listening to your insights. So now we've got our community feedback part of the forum. So if you want to respond to any of the questions, which will show up on screen soon, please click the raise your hand button or write your response in the comments and we'll read it out. But we prefer that you raise your hand and we'll pop you on screen. So when you respond to a question, just quickly introduce yourself and then you'll have 2 to 3 minutes to speak. So I'll show our first question. So our first question is, why is it important for mental health organisations to utilise language services to connect with communities? So I'll go first to Micah for this question, and then I see there's a few people who want to respond already, so that's great. Micah, if you're there, if you want to respond.
Hi, my name is Micah. I'm one of the project managers at Polaron Language Services. Why is it important? I think it's been mentioned over and over again during this discussion. Mental health is an issue we are all experiencing, and especially with these hard lockdowns that have stretched us so much in terms of anxiety, depression, isolation, and so on. So I believe it's really important that communities that don't necessarily speak English have access to those resources in a language where they feel safe and comfortable. So whenever they go to a doctor, talk about their mental health issues, they're able to speak in a language they can express themselves properly, rather than using English, which might not be their first language, and that might create even more barriers in terms of communication. So, or for example, in terms of having access to resources that they can understand much better. So they are adapted to their culture and I speak to them in a way that they feel is to them and not to the mainstream group. So I think those are aspects that everyone has been mentioning during this forum.
Thank you so much, Micah. Hands gone, but Yusuf, you had your hand raised. Do you want to respond to this question? Oh, we've actually got someone else. So Saha, you're welcome to respond. Oh no, people are popping up and going down.
Actually, I thought that we are asking questions. That's why I put my hands up.
So we will be asking questions shortly,
yes,
just after this.
After, okay.
Yeah, perfect. Thank you.
So can I just, sorry, my name is Yusuf. I work for ECCV, so the Ethnic Community Council of Victoria. A lot of this, and I work as a disability advocate, and there's a lot of similarities with mental health. My thing is a statement, not to address the question, but there's a lot of similarity between disability and mental health, and I think it falls under the same umbrella. And I think, for example, if I use the NDIS, they just assign LACs to anyone and everyone without looking through a cultural lens for the appropriate worker to work with that family or individual, so that individual can learn about their plan and empower themselves, rather than relying on interpreting services that may not be able to say words like advocacy. Because when I use words like that, I think it's human rights and it's law. Advocacy is very different from law. So they get very confused and it's very hard for them to understand. So I think if you're going to break down mental health, I think appropriate languages need to be considered when empowering individuals or families. Thank you.
Thank you, Yusuf. Eva, did you want to have a comment there?
Look, I think in terms of language services, I think it'll be good for organizations to understand what that is. And, you know, sometimes an interpreter will be appropriate, sometimes a translated information will be appropriate, sometimes it'll be a fact sheet on a website. So it's about looking at what works for certain communities. And, you know, somebody in the comment earlier, you know, mentioned that there are so many communities in Victoria and in Australia that it's really hard to pinpoint or talk to them directly, but we must, because the cost of not doing so is just too high. And whether, you know, it's a disability sector, mental health or anything else, you know, the cost of someone missing out on a vital service is just really incredibly high, and it costs the community in the end. And it's also the human factor of people feeling excluded from the conversation. And I think not being afraid of, you know, language services and knowing that it's not going to work 100% of the time, because there's no common language. It's pretty simple, and it's not always going to be 100% successful as if there was no language barrier. But it's still, we still need to try. Yeah.
Definitely. On that note, we might go to our next question. So we might go to just slide 2 of this one. Thanks, Zara. So Saha, did you want to respond? You're welcome to respond to the first question as well if you prefer, up to you. Thanks.
Hi everyone, I'm Sahar from Victoria, I'm president of Australian Iranian Society of Victoria. I think that there are a lot of examples actually worked very well with the providing the resources for many different languages, and it's all been worked, especially during the COVID. With providing that, for example, these services, they're all available. The phone numbers, all of those things that it's been in many different languages, I think. But I have a question myself. I'm not really sure that if anyone else can respond to this, that for considering living in Victoria with a lot of mental health issues nowadays, it's just rising up, and their numbers are just like rising every day, and a lot of other things, family violence and all those other areas. Most of the Iranian or Farsi speaking counselors and psychologists, they're all fully booked out until next year. So we don't have actually many appointments available. It's literally, there is nothing. And if the people want to reach out for others that they're not speaking Farsi, the problem is that people, they don't know how they find someone who can translate and who can trust, actually, because I do get a lot of conversations, phone calls every day that they're worried that because this is a very sensitive area and people, they don't want to expose their personal information to a third party, to someone else. So that's why it is very important. We will be very clear in this part as well. I think that I saw someone was mentioning that we do have, it would be good if we have someone who is working within the mental health area already, and then they can help with the translation as well. The only thing that, again, I teach mental health myself, I teach nursing, but this is difficult, that how we can actually show emotions, reactions, all of this within the mental health area, like when someone is explaining or talking in another language. That was my question. If someone can answer, that would be great. Thank you.
Yeah, look, I still do a little bit of interpreting, but I not so much. And I used to work in mental health a lot, and it's a very challenging area. I think to get it right, it's a combination of things, of educating everybody that takes part in a interpreting session, let's say. So this is notwithstanding the shortages of Farsi speaking counselors that I cannot help with. But what we should be doing is involving interpreters from the very beginning, including training, support, briefing, debriefing, because usually interpreters just turn up, yeah? And, it's not often that it's mentioned to the clients that they also need to keep everything confidential. They have a code of ethics, right? So it's often assumed that interpreters might spread rumors in the community or whatever. You know what? We have better things than that to do, but it's a real fear when it comes to mental health, of course, or any other areas. So it's about how do mental health professionals work with interpreters as colleagues rather than people that just sort of drop in to an exchange and they're not really prepared. They may not have vocabulary that's sensitive to the conversation. So it's really quite a challenge across the board. And then if you speak to interpreters, they will tell you that they're rushed, that they are not briefed, that they're not debriefed. So I think that conversation, we need to keep going with it. And if there are no Farsi or Vietnamese speaking counselors, interpreters do need to come into the picture, but they need to come into the picture without causing damage to the exchange. And that comes with, like I said, education and better preparation, and also better pay. But that's another story. Yeah. So I hope I've been able to kind of answer that question. We have some other people that raised their hands, Stephanie.
Yeah. So if Senator wants to speak now, you have your hand raised.
It's another from Bosnian community, also working for Australian Croatian Community Services. Saha actually raised some points that I was gonna talk about, but here we have a question: what did work, what worked, and why? So to connect to the communities now, I'm not talking just about interpreting. To connect to the communities, there is a middle person. There is that person that everybody trusts in the community is one of the most important people to connect to any services that are available. Because people would call, for example, me, they would call me, they know me from the community, and they will ask me where to go for help. So if the organization can connect to those people, the leaders in the community, I believe it's the best approach. And in many other topics and many other problems that we had, it did show that that was a good thing. Also, I have I must say something. When I came to Australia 20 years ago, I came as a refugee. And then somebody told me that there is an organization that helps people like that they're coming from the war, and it's called Beyond Blue. And I didn't speak English back then. And the person translating that stuff, she said Beyond Blue. And I did not connect at all that can have anything to do with the mental health. Still now, whenever I see that Beyond Blue, think like, oh my God, is there something else? So that is something that was my still I have that in my mind, thinking like, even that the interpreters, I'm not interpreter, I'm just community worker. So interpreters have to have that knowledge of when we talk about mental health. And just last year, I done the course. It's called First Aid in Mental Health. Maybe it's not bad thing for. I'm not sure if that's included in the certificate or diploma or whatever. But maybe because that topic, the mental health is one of the most important ones. Because just with one word that we translate differently. Can be fatal, can be very, very dangerous, especially if I'm talking about the languages Bosnian, Serbian, Croatian. Most of people think that they are the same language. Yes, they are 80% same language, but then there is differences as well. So, yeah.
Yeah, excellent points. Stephanie, we have one more question, and then we open up the floor, I think.
Yeah, I think we'll go on to our next question. Hazara, if you're happy to change the slide. As I am aware at the time. Thank you. So this question is, what more could we all do to improve language services for multicultural communities? I don't know if anyone wants to raise their hand for that one.
Otherwise, we'll open that up to the panelists, because they have had lots to say, and maybe there's something more they want to contribute. Niharika, what do you think? What all could we all do?
I'm probably starting to sound like a broken record here, but I think one of the good places to start is to look at the points of strength that already exist within the communities and the conduits, I guess, for these conversations and that capacity building and development. I think we often try to, it becomes a black and white conversation, right? It's either that we need to fully upskill someone from the beginning, or we need to work with, specifically non-diverse mental health clinicians and build their cultural capacity. And actually, there's just so much existing strength and knowledge and real in-depth and specific knowledge around mental health and around the diversity stuff that we are not really tapping actively into. And even if we're going off of, for example, the hundreds, thousands of grassroots initiatives that are now starting to emerge of people speaking about their lived experiences, Instagram pages, people starting podcasts and bringing people online to start to talk about their own experiences, really looking at how we can leverage and support those people, those organizations to continue doing the work that they're doing, but build their capacity to have further input into the organization and the system as it already stands, I think is a really good place to start.
Thank you, Niharika. So I might, if Judy's still around, I'll ask Judy that question. What is there that's more that we could do?
After Niharika's wonderful response, you know what, I'm going to further her response.
Can you do better? No?
I no, never, can never do better. I will further that response in the sense that I absolutely agree. I think in addition to that, we as multicultural communities have so much opportunity to learn from each other. A lot of the what we call existing multicultural communities that have been in Australia for longer, in some sense, would have a wealth of resource that we should and experience and wisdom that we can share with new and emerging multicultural communities on how we might be able to support them, and the other way around. So that's how I would sort of add to what Niharika has already kind of mentioned from there.
Thank you, Judy. So over to you, Sammy, if you're still around. Would you like to contribute to this question?
Yeah, I think someone has said in the comments, which I think is really important, but advocating for more funding for training. I think we've spoken a little bit already about the lack of funding that's involved, which is very unfortunate. But I think, yeah, it's really important to train interpreters in terms of mental health first aid and things like that. And also something else, which isn't directly related to this question, is we hear a lot about cultural competence, which I think needs to shift a little bit, because I think what mental health professionals should also do is start reflecting on their own implicit biases and assumptions and beliefs that they have about certain community groups, because that can really translate into your interactions with other people. So I think whilst it's good to be culturally competent, as people say, I think there needs to be this shift to be more culturally safe. And that starts a lot with critical reflection and engaging with supervisors, with consultants, with educators in the community, and really breaking down your own biases. And yeah, that basically is so important, I feel.
Thank you, Sammy. We might go Yamiko and then Ingrid, and then we'll open up for the floor to ask questions of the panelists. Yamiko, have you got something to tell us that we haven't heard yet about what we could all do to improve things?
I think it's just acknowledging what a lot of people have already said, to be honest. I think I really related to what you were saying, Yamiko, in terms of leveraging what's already out there. And that's something that we were aware of when we kind of started to think about this project that we were involved in. And the amazing work of, for example, Victorian Transcultural Mental Health in terms of supporting interpreters, in terms of central CMY, in terms of supporting young people to develop their confidence in working with communities and being community advocates as well. So it's a great part, I guess, great to be part of the conversation, but great to see the work that's already out there and how we support that. I might pass on to Ingrid, so we've got time to hear from her as well.
Thank you. Over to you, Ingrid.
Thank you. I feel like everyone has actually answered this question, and I think it's a work in progress. We've actually done a lot without us realising. We have come a long way, even though there are tiny steps. It sometimes feels like 3 steps forward and 4 steps back. But I'm thinking, to build on what everyone has said, we need a dose of courage, we need a dose of humility, grace, respectfulness, and trying not to be judgmental. And often I know that in my own community, we're really good at judging other people. And that's where some of our biggest problems start from, because we are so quick to judge each other. And that's been a real challenge to try and change that judgmental nature that many of us have into something that's much more respectful and neutral. And I don't mean to be disparaging of my community, because I love my Latvian community. However, that's also been a trigger for my own mental health challenges, and why many of us have actually changed how we relate to each other within our communities. Some are walking away, some are staying more tightly part of their community for a whole range of reasons. But I sense in my own world, it's a lot to do with, because of that sense of mental health is interacting on every level with each other, and there is that stigma and there is that fear of being vulnerable. But if we can share with all the different communities those challenges, because I sense that there's a lot of commonality in what we're facing, it's how we actually go about harnessing our commonality and then use that to help address the differences between different cultural groups. So courage, patience, tolerance, and knowing this won't happen overnight. Change is slow, and it may take as many generations to get out of this, hopefully not, as it has that we've come into it. So we have a bit of work to do, but if we can do it together and maybe put some hand grenades down and do it with a bit more and with a lot more respect and less judgment, I think anything is possible. Everything is possible.
Some very wise and inspiring words, Ingrid, there. So I'm going to open up for the audience to ask questions of the panelists, if there are any. Otherwise, some people have to leave, and we can, somebody's also put a guide from let me just have a look. working with interpreters from VTMH, which is Victorian Transcultural Mental Health. That's a really good guide, which I, in its previous iteration, I happened to be involved in. Any questions to the panel, to our esteemed panel, I should say? Very knowledgeable.
We do have a question for you. Yusuf has put his hand up. You can go right ahead.
Go for it.
So, thank you for allowing me to talk again. My question is around to the panelists. So my first comment that I made was it should be up to the society to adapt to the individual, not the individual adapt to society. I think our system makes the mental health system unreachable and every other community service industry unreachable because there's little things, there's environmental barriers, there's employment barriers, there's a whole heap of range of barriers that our system doesn't cater for that allows people not to go and get services or help that they need. One of the things I mentioned before was Braille. The people aren't addressing people from Braille. So when people come overseas and you fill out that form, declaring what you have and where you come from, that's not in Braille. So how is someone that's blind gonna be able to access services when they first come into the country, deal with all their issues, they might have mental health issues, and get the appropriate assistance they need? And I just want to ask the panel is, are we putting in these measures and looking at things holistically, or is this just another mental health pump we need more money in? We're not looking at where the money really needs to go to. On mental health is one thing, but there's a whole heap of things that we need to address in our community service system. And I think Braille is one of the things that don't get mentioned. I mean, even businesses' cards don't have Braille on them, and we're not thinking like that anymore as a holistic approach. And I just want to know, do the panel feel my view, or are there things in place where you guys are actively trying to address these issues?
I think that's an excellent question, Yusuf. Who wants to answer?
I'll start. I'll start the conversation. Thank you for that, Yusuf. That's a very, very good question. And certainly a lot of organizations and government structures are looking into the notion of intersectionality. I feel like in many ways you're talking about intersectionality, how to have an intersectional lens and approach. The concept itself, honestly, is an evolving concept. We're still trying to understand how we can best do that. But I agree with you entirely. I think it has to be a holistic approach as much as possible. And the only way we can do that is by working together, multicultural communities working with disability organizations, and sort of government working with multicultural communities and LGBTI communities and aging communities and the youth and so forth. But until we find a way, the best way to go about that, so that we can have a truly intersectional lens and approach to our society, that's something that we'll always have to be working on towards. And it sounds like you, I mean, I perhaps was not so much of a disability advocate in many ways until several years ago, when I had the absolute honor of getting to know some people living with disability, and even just something as simple as catching public transport to get into the city with them. I had no idea the absolute barriers they had to face for something that I took for granted. And so that's my journey in the privilege that I have as being an able-bodied person, and that learning process in itself. So I think, is there anything we can do? I just hope that we can all become advocates and speak up for other intersectionalities, and acknowledging the privilege and the power that we have to assist others. And it's, by lifting our brothers and sisters up, that we also lift ourselves up. So that's what I think.
Yeah, that's a really, really excellent point, actually. I might get one other panelist to speak, and we've got about 6 minutes left, so I will have to hand over to Hisara in a moment. Anybody else from the panelists that wants to contribute to Yusuf's question?
Otherwise,
I'd love to jump in. Oh, sorry, folks.
Okay.
I'd love to jump in with two really quick notes around that too, and thank you, Yusuf, for the question, and thank you, Judy, for your your thoughts. The first, I think I would say, is that it's really important in this type of stuff to know that duality can exist. Like, we can be in a system that is not right for so many people in the system, and things are going to keep coming up, and being open to addressing those whilst keeping sort of what an ideal system looks like in mind. But I do want to make reference, and which is my second point, to something that Sammy mentioned earlier, which is critical self-reflection. And that's not just in the sense of local clinicians or people who are working, at sort of local levels. I think that goes all the way up to all of the decision-making capacities, like really being open and critical about the way that you approach these situations. To know, I don't know if you folks have read this book. There's this beautiful book called Living on Stolen Land, and it talks about the need for decolonization and decolonizing practice. And one of my favorite lines in this book is, the only way that you can know that you would never get anything wrong is to know that you could. And being really, really critical and aware that you could have all of the research and the understanding and the experience and the professional experience and all of that in the world, but unless you're willing to really be aware that there might be more work to do, and what's your role going to be in that, nothing will sort of change or happen. So I think critical self-reflection is everything in this space.
Beautiful. The best kinds of forums are those where we run out of time and we leave hungry for questions and answers. But I've got Bron, so I'm going to hand over to, we've got 1 minute, and then it has to be Hasara. Go for it, Bron.
Thank you. And I did pop this in the chat earlier in the session, but in our work with young people talking about mental health, they often refer to their spirituality and or their religion. And I wondered if any of the panelists could talk about ways that we can reflect that and acknowledge that in the resources and services that we offer with our Western mental health lens.
Anyone that wants to, we'll just have one person answering that if anyone feels that they can answer that.
Yeah, I can make a comment. Yeah, I don't have all the answers to this, but I think in terms of incorporating religion and spirituality, I think something really important for mental health professionals and organizations is to be curious and to want to explore it further, and not to ignore it or think that it's an area that is out of their expertise and they don't want to touch it because it makes them feel uncomfortable. Because spirituality and religion, it very much overlaps with mental health, and it really informs the way people see the world and themselves. So we have to address it. And I think part of it is going away and trying to learn things yourself, doing your own homework, I guess you could say, but also using real lived experiences and insights from people to inform you as well. So a balancing act between doing the work yourself, but also learning from the very people that you're trying to help. I also think in terms of you being unsure about something, seek out advice. There are community groups, there are organizations that can speak more to this if you feel like you would like further explanations and understanding about things.
Wonderful. Thank you, Sammy. Hasara, we've got 3 minutes and lots to say. So go for it.
Yeah, no worries. I just wanted to thank everyone for coming to our forum today. This is exactly what we were hoping for, very considered and important feedback on how we can better make mental health services more accessible for all multicultural communities. I think some really great points were made, both by our panelists and the people who attended. For me personally, I really liked that we discussed that there was a lack of culturally responsive literacy surrounding mental health services. And I think it does come back to maybe educating the future bicultural workers and specialists that will be working in this field. Like, as there was said before, this change is very slow and it won't happen overnight, but it is important to utilize whatever resources we do have to help facilitate that change. And that's where I guess language services also come in. And we just want to let everyone know that we're also here to assist with this sort of process. And it is a matter of addressing the intersectionality between multicultural communities and the specialist providers as well. And we want to help facilitate that. So we'd encourage everyone to reach out to us with any sort of questions, queries, or services they may be looking for. But other than that, I don't really have much else to say. I just wanted to thank everyone for their input.
That is very lucky, Hasara, because we've only got 1 minute left.
Okay.
We had over 80 people attend, and those of you that couldn't will receive a recording, and we were streaming it live on YouTube as well. I personally have gained so much knowledge, and I have to tell you that I feel more positive about the road ahead. I think mental health, everyone's got mental health, regardless of where you come from, what language you speak. It is something that we need to take into consideration. You know, there's no health without mental health. So I felt very privileged, firstly, you know, to have such esteemed panelists participate, but lots of practical steps and lots of ideas which I'm sure that we'll benefit from. So thank you everyone for attending, to everyone for presenting, asking questions. Like, this was a very dynamic question with lots of input through the chat. So we will present and prepare an impact report and send it to everyone for further consideration. And look, one thing that definitely resonated with me, we need more statistics, more data, and we need to push this agenda. As difficult as it is, you know, we'll be changing people's lives one person at a time, and that is the best we can do ever, right? And also thanks Stephanie and Hasara for helping put this together.
No worries.
All right, and have a great afternoon, everyone. Thanks heaps.
Thank you.
Thank you. Thank you very much.
Thank
Take
you
care.
so much.
Thanks,
Bye.
everyone.